Hi there, this is Missy Larson, Vice President of Philanthropy here at dōTERRA, and I'm so excited for you all to be with our guest today. It's been an incredible journey that we've all taken with the HOPE action plan, and we want every single one of you to be a HOPE advocate. And I think as you listen today about what's going on in Utah, you can also think about what's going on in your own communities. And if you are listening to this podcast, you are like me and strive for overall wellness. A recent study of 1,230 U.S. adults found that 93% of adults in the United States have health and wellness goals, and 84% of us are actively working toward achieving our goals. The practice of engaging in healthy habits daily to attain better physical and mental health outcomes matters. And as we have seen clearly over the past 2 years, our social connectedness, which is connecting with our friends or loved ones and finding ways to think beyond ourselves, is also critical for overall wellness. We are fortunate today to have experts in mental health and educational training to help us explore overall questions in health in young adults and children. What is a healthy child? What patterns can be established to protect our youth? What are the greatest risks? And how can each of us find a way to support our vulnerable children and those aging into adulthood in our communities? As we dive into the world of wellness today, personally and collectively, we are hoping that some of what is discussed will also help you find ways to reduce the stress and trauma in your own lives and in the lives of those you support. Because wellness matters today and tomorrow. Joining me today in today's conversation are people who have made a focus on wellness as part of their mission. With me today are child and adolescent psychiatrist Dr. Christy Kleinschmidt and Josh Loiza, who is the education director for the Protect Utah program. We're first going to talk to Christy a little bit about her experience. So Christy, tell me a little bit about, you are an assistant professor in the Department of Psychiatry at the University of Utah School of Medicine. You have an incredible bio here about how you help children and adolescents and young adults with mental illness. Tell me a little bit more about your background.
I am very happy to be here today. So thanks for having me. So I did my medical school training at Tulane University School of Medicine and moved to Utah to train in a combined training program, which is pediatrics, adult psychiatry, and child and adolescent psychiatry, and then have worked at the University of Utah since graduating years ago. I won't share how many. And so in my career, I have worked in a spectrum of mental illness levels of care, including inpatient psychiatry treatment, outpatient therapy, outpatient medication management. The bulk of my career has been spent in a day treatment program for children and adolescents who are struggling, typically emotionally and also with their school performance. And so they come for more intensive treatment Monday through Friday. I also am involved highly in education. And so I participate in training psychiatric residents, child and adolescent psychiatry fellows, so our future mental health clinicians as well.
Awesome. Josh, I know your program well as the education director for Protect Utah programs as part of 3Strands Global. dōTERRA, where I am now the VP of Philanthropy, we get to work all the time on working together to solve some of the crisis around human trafficking. And so tell us a little bit more about you and how you prevent trafficking through education, through the education model of Protect.
Yeah, thank you, Missy. Super excited to be here as well. Protect is a human trafficking prevention education program. Our whole focus is prevention through education. Can we educate specifically students and youth in the school system? Can we educate them on what human trafficking looks like? Can we educate them and give them a few skills on how to find ways to prevent human trafficking and escape the tactics that traffickers are using? Right now, currently in Utah, the Protect program has reached nearly 75% of all schools in the state of Utah. We've also trained over 35,000 school staff members, all in this attempt to, can we change the perspective of what human trafficking is in Utah? And it's been an incredible journey, all made possible in part because of the generous funding and support of dōTERRA. Without them, none of this would be possible. And so we're extremely grateful and excited for this journey that we're on.
Well, we love working with great partners who are doing the work, and we're appreciative of all you do with the teachers and the students. So, Dr. Kleinschmidt, it's when we started talking even before this podcast, and I was so curious to know what you see in your practice. Could you tell us a little bit more about what is the span of what you're seeing? What are you doing on a daily basis now?
Yeah, so, I think the pandemic has affected an already increasing, I would say also pandemic of just mental health issues in our children, in our teens, and our young adults. We get kids, I'm going to use the term kids sort of loosely to describe kind of the population I work with, which is anywhere from 5 to 18 years of age, from all over Utah, from all different, spectrum of family environments. I think there's a lot of thought that, oh, that can't happen to me because, I live in a 2-parent home and I have never had trauma and, I've never, faced something horrible happening. And the reality is that mental health issues in our youth happen across the board for everybody. Every 2 years, the Substance Abuse and Mental Health Association conducts a survey of students across high schools and middle schools throughout Utah. And 2021 was one of the years that we got results from those studies. And concerningly, this year, about 50% of the students that were surveyed in Utah reported moderate or high mental health treatment needs. So this was their self-report. 41% of the kids who responded said that over the past 30 days, they had felt hopeless, depressed, or even had some thoughts about suicide, and they hadn't told anybody about them. And 22% of the students, they added in some questions this year about the pandemic, and 22% of the students have reported feeling isolated. And so that was up quite a bit from 15% just 2 years ago. And so I think even prior to the pandemic, we were seeing increasing numbers of kids across the board reporting depression, anxiety, having a hard time feeling connected to others. I think social media has certainly contributed to that. And then with the pandemic, I think our students' feelings of isolation have gone up quite a bit as well.
Yeah, it is amazing. I hear the statistics a lot, and I see it in a lot of different ways. The mental health issues. dōTERRA works a lot with different countries, and I mean, you see it globally. Some of the countries that are really, really tied down because of safety reasons, like Australia, you see a very high mental health issue that's coming out of that. So I totally understand what we're seeing here. So Josh, you see this in the way of the training. Could you help us to understand what we're seeing in the way of increased risk for trafficking and other crimes?
Yeah, it's definitely with the way the pandemic has been and everything that Dr. Kleinschmidt was saying, it's increased the vulnerabilities and the risks to human trafficking. We're seeing this specifically in the school system as well. When we're training, and I've had the unique opportunity to train and work with school staff members and counselors and teachers and administration all across the country. So I've got to talk to them and hear a lot about the situations that they're running into with youth, especially within this pandemic. And we're seeing that increase in vulnerabilities with this isolation and these factors that are leading to, when we understand trafficking, we understand that traffickers are actually systematically targeting these vulnerabilities. And so the more vulnerabilities that we start to see, the increase in housing insecurity, food insecurity, isolation with the pandemic, we're now starting to see an increase in trafficking as well, because if they cannot find those needs that they have, that makes them vulnerable. So they go somewhere else to find the solution for those needs, to find that support, to find that financial stability, to find that. And that's where the traffickers are. They're looking to take advantage of.
Well, and let's address this right up front. And maybe Dr. Kleinschmidt can help us understand how the vulnerabilities within mental health, emotional health, spiritual health, as that disconnects more, how it increases the possibility of becoming trafficked or being involved in other problems.
Yeah, so I think, the population that I work, of course, one of their primary vulnerabilities is just untreated or undertreated or unrecognized mental health concerns. And so what we have seen over time, right, is the earlier that you can identify these issues and get kids into treatment or find, supportive social environments for them, that can sort of help prevent that vulnerability. But as these mental health concerns continue on, and as other adverse events happen, such as traumas or homelessness or, kind of our adverse childhood events, parental divorce even, or like loss of a caregiver, bereavement, housing insecurity, food insecurity, like Josh was talking about, sort of as those add on, kids who are experiencing those have disruption in sort of their social life, have disruption in sort of their feeling of kind of control and confidence. And it really does increase their vulnerability to looking for support for their mental health, for support for those other issues outside of the home. And so they kind of have an additive effect to putting kids at higher risk for being victimized or trafficked or put in other risky situations.
So we've talked a lot about risk and about what happens in these very risky places. What is a healthy child?
Yeah, that's a good question. I guess I'll start with that one. So, in my mind, a healthy child sort of first and foremost starts out by feeling this kind of unconditional love and support from an attachment figure. I mean, that's, typically a parent. And by that, it really is, like my parent sees me for the good things that I am, and they still love me for even through the bad things that I do. And that you value, that the children are valued for kind of what they can become as well. Healthy children also tend to have a supportive peer group. They feel well connected to others. And then they can have this sort of sense of self-efficacy and self-confidence in their abilities and their competence in the things that they're learning how to do, right? Being successful in school, being successful with peers, working on forming their identity for kind of who they're going to be for their life. A healthy child as well, I did do pediatrics training, so I do also have to talk about, attends to their physical health needs, right? So gets exercise, gets pretty good, consistent sleep, focuses on a pretty consistent, like well-rounded, nutrition and sort of some of those other things too.
I love that you brought up before that these vulnerabilities are not really socioeconomic. Are you seeing across the span, like, obviously, I think in our heads, we think, oh, my children aren't, if I've got a 2-parent household and I have the means to support them with food and shelter and all of that, then they're not at risk. And what are you actually seeing there?
Yeah, no, I see kids from all over. We have certainly kids who struggle financially, like come from families that are struggling financially, from families that have divorce or bereavement, but also 2-parent households who send their kids to private school and they, go jetting off to wherever for their spring break. And so it really, mental health issues just run the span of humanity, really. It really can affect anybody. And the other piece too is I think in what I talked about before, 40% of these kids who struggle didn't tell anybody. I mean, that's a huge number. And so a lot of the kids that we treat really have struggled to reach out to their parents, even some that they're really well connected with, to disclose some of these mental health concerns that they have. I think a lot of times due to stigma or just, sort of this perception that maybe they shouldn't feel that way because they come from this loving family home and they've never seen anybody talk about their mental health struggles before.
And I appreciate that. I happen to be the founding chair on the Safe UT app. And so I'm still involved with really, and it's right there with the work that you're doing at the Huntsman Mental Health Institute and Hospital. And it's so fascinating for me to read some of the data that's coming in, some of the response to that. And I just wanted to make sure we put a plug in here that if there is anybody who really is in a crisis or needs support through a crisis, and it could even be the parents that need to know what to say, what to do. Safe UT is available for it was really in all of the schools, but it's also for parents. They can reach out on smartphone app, and then there's numbers that they can call. So I know that there's a number that comes in right there to the therapist there at the Huntsman Mental Health Institute. Do you have that number on hand just for as a resource?
Yeah, so if people wanted to call, the number is 1-800-273-TALK or 8255. That's 1-800-273-8255. That is the National Suicide Prevention Lifeline, and it is staffed here in Utah by the Huntsman Mental Health Institute folks that also are participating with the Safe UT app.
So if you don't know about the Safe UT app, that is just a downloadable app on your mobile phone. Josh, you are training teachers, and I know I have seen some of the response that comes back to the teacher when the light goes on. Like, oh my gosh, I have seen that. So could you tell us a little bit about what you're finding out, what's resonating with teachers, and what are they learning about human trafficking when you do the trainings?
Yeah, it's an awesome opportunity to be able to talk to these teachers, to be able to see that light bulb come on, to see the growth, as to help them through this journey of changing their perception around human trafficking. There's really two key points that always stand out to them that I hear a lot in our feedback. And we have an opportunity through our program to take stories and testimonials and really get that feedback. And we've now had over 20,000 stories that we've received from teachers and school staff members, bus drivers. And these two concepts are really the ones that they're latching onto. And the first and foremost we touched on is that vulnerabilities lead to exploitation. And when they start to recognize that, they're always thinking about their students. They're looking back to their students in previous years, in their current classes. And a lot of them will say the same thing of, oh, I wish I knew. But they also say, oh, I'm so glad I know now. I'm so grateful that I know what these signs are, what vulnerabilities look like, all the things that Dr. Kleinschmidt was mentioning. They've been able to now start to recognize in their students. And that gives them the opportunity to intervene, to do something, to make an impact in the lives of these youth. And it's a beautiful thing when they start to see that and see the impact that they can make in their role in prevention. And then the second one is a trauma-informed approach, shifting that perspective from what's wrong with you to what happened to you. A subtle, empathetic shift that really changes their perspective when it comes to looking at the behavior of youth. One teacher told me, she said, behavior is communication. And I thought that was a beautiful way to explain it. And it's so important for them to see that the behavior of this youth is oftentimes trying to communicate something to us. And so to look deeper and look at what are they trying to say, to not just say, this is a bad child, this is kids just acting out, but to say, what are you trying to communicate to me with this behavior? And so when that light comes on and they see that and start to see that shift, it resonates. And so we see that consistently from them.
Dr. Kleinschmidt, I'm sure that resonated with you in a lot of ways. So I'd love you to jump on that a little bit and explain how what Josh is saying right here, the tones of things. I love that we are so much better today than we were even 5 years ago about understanding what trauma-informed means. Can you help us to understand that a little bit better and also maybe go into a little bit of what came up with you as you were thinking about what Josh was just saying?
I love what Josh said about the teachers kind of recognizing that behavior is communication. And that really does set up that sort of unconditional positive regard that I was talking about that really can be preventive for some vulnerabilities for children, right? To have teachers see them for their potential and not just sort of dismiss them for the behaviors that are happening. We don't know what people carry with them. We don't know what these kids have been through. I think a lot of people try to judge what traumas could be. And there's lots of, I guess I'd say like little t traumas, right? I mean, we don't know who's been bullied. We don't know what kinds of life events have affected kids in very negative and impactful ways that would be considered trauma. And so, having that lens of, okay, what has happened to you? How can that help me better understand what you're going through? How can I provide a safe space for you to not feel judged, not feel dismissed, and be able to reach your full potential academically, right? I think, school failure, like early school failure, like in elementary school especially, really can set kids up for this really negative trajectory, right? I mean, that's what they're supposed to be doing during that stage, is just being a good student and learning the things that they're supposed to learn in school. And so if we can't set up the mechanisms to support kids to be successful in that situation, we really are setting them up for future difficulties. And so having teachers that are advocates for them in that respect is just an amazing intervention that we can be doing.
Have you seen a difference? Are we getting better?
We are. Our schools are really trying to do a few different things. They've rolled out social emotional curriculum. They are teaching trauma-informed approaches to their teachers. They're also doing a lot with flexibility and with having a growth mindset, right? And so, you failed this time. How can we get back and help you succeed? How can you look at things with a different lens? And I think we used to be very harsh and very sort of rigid and black and white with what means success in school, or what the deadline should be, or what your expectations should be. And if you couldn't meet them, you just failed. And at this point, it really has taken a different turn of, okay, let's support you. Let's figure out what else is going on with you.
It has been so fascinating for me to watch my kids' educational process in relation to what I had. I remember in 8th grade, my algebra teacher seated us by test scores, and I wasn't very good at algebra. We'll just say that. And so I was always at the back of the room, but that had an impact on me. And I had other successes in my life at the time, so it wasn't so impactful. But I can imagine that a child who may have had other compounding issues going on at the time, it could have been devastating. And I think I have seen a difference in how teachers are, just even with my children, and I appreciate that they're willing. I mean, I always say there's two people that go straight past whatever there is a holdup to the greatest glory after this world, and that is teachers and nurses, because I just think they are beyond this world. And I think Josh sees this in the types of things that are coming back and the responses that are coming back when they are trained. And so you started to go here a little bit, Josh, but I'd like to know a little bit more, like what are some of the specific things that teachers have come back with after training?
Yeah, again, they're always thinking about their students. So we have teachers when they complete the Protect training, and they'll call us and say, I need to go talk to someone right now. I have a student in my classroom right now that I know is going through this, and I need to go do something. I need to call somebody. They'll often call us for help and suggestions about, they recognize it in their granddaughter, recognize it in one of their kids' friends. It's one of those things that once you start to learn about it, once you start to learn about the signs, especially, if you work with youth, you start to see it all over. You start to see it everywhere.
Okay, so this is a question I'm sure everybody is asking, and it's always the question that I'm asked after working at the Utah Attorney General's office, and it is really, what does human trafficking actually look like in Utah? Now, some of this is just that higher risk that we're talking about. So, Dr. Kleinschmidt, could you tell us a little bit about, we were talking about some of the populations that you've served where the risk was higher. Can you explain that?
Yeah, so previously I had worked in a residential facility for youth who were in custody, either in, Department of Children and Family Services custody or juvenile justice custody. And often the kids that I worked with were, primarily female and had typically run away from home, started using substances, were homeless without a lot of resources, and were connected with folks who then began to traffic them. And so all of those, you can go way back, right? And so a lot of times parental mental illness, really consistent, housing insecurity, lots of frequent school changes, really never felt successful at school, didn't have a cohesive social group, leading to them kind of running away and trying to seek out some stability on their own, and then really getting victimized and targeted because of those things.
So we're really painting this picture of vulnerable people. And so, Josh, what do you talk about and how do you train in the state of Utah on what actually to look for? When do you call in a tip?
Human trafficking, there's a common misconception with human trafficking that we see with people inside and outside the school system. And really, pretty much anybody that I talk to about human trafficking, I see the same thing. It's a common misconception that human trafficking has to involve kidnapping. It has to involve abduction or smuggling of some kind. And so that's really where we start. Human trafficking more commonly looks like what we call the grooming process. And so we start to explain this process, which you mentioned, Missy, is grooming process is where the trafficker systematically is going to target and identify a vulnerability of that youth, and then or of that person. Doesn't have to be a youth. And then they're going to, a lot of times, find that need, fill that need. And so the relationship will start out in somewhat of a positive way. And then they're going to leverage that need to take advantage and exploit that individual. And so we see this, and that's more of what human trafficking is going to look like here in the state of Utah. So we had a recent case in Davis County, Utah, where the trafficker, he befriended these women, got them hooked on drugs, gave them drugs, got them hooked on and addicted to these drugs, and then leveraged those drugs to set up what he called dates with commercial sex acts. And he set these up for them, and if they didn't do it, then he wouldn't give them their drugs. And if they did, then he'd give them their drugs, right? And so he's leveraging these drugs and this addiction that he got them hooked on in the first place to be exploited and to actually, commit human trafficking.
Yeah, I love how you brought that up, because there's so many elements that people get wrapped up into and become trapped in. And I think oftentimes we look at somebody and we think, oh, it's a choice. The more and more I've worked in this area, I've realized very few people are in that trade as a choice. And we have to open up our ways of trying to figure out how to support people that are in those vulnerable places and how to have laws that actually support that. Just a few years ago, Utah put in a Safe Harbor Act, meaning that if somebody had committed some sort of crime that they had on their record during the time of being trafficked, and if they came forward and were able to connect that to that crime that they were pulled into, that those would be wiped. And it's an incredible freeing law, because it allows people who were vulnerable, who were trapped, to come out of that and be able to move on in their lives without a rap sheet, as long as sometimes 200 charges. And so many times the traffickers will put the names of things in the women's names or in the people who are being trafficked names. And so they're trapped with this. And so we're getting smarter in a state. The federal laws are getting smarter. We're understanding this better, and we're moving forward on this. And I appreciate this vulnerability discussion, because I think so often our minds are kind of wrapped in the wrong way, and we think of that snatching because of movies or because of what we've been told. But the reality is that isn't. It's more of this grooming. And when we hear grooming, I just found, the last few times I have talked about this, there's always a parent in the audience that comes to me after and says, that happened to my daughter. That happened to somebody that is close to me. And so this does happen in our homes. And one of the things that I wanted to bring up was at the Attorney General's office, they're finding that these creeps hide in games. And so you've got young children playing in games and they're leveling up. Well, law enforcement, how do they level up? And so they're finding ways of doing that. But it's when you've got somebody on a computer 24/7 and you're leveling up into games and these kids are there, it's an unsafe place. And so I think as parents, we need to understand that. And how do we teach parents about how to understand what our own children, people in our own household, where are the vulnerabilities and how do we set those boundaries up so that we can protect our own even?
Yeah, that's a great question, Missy. And especially I'm glad you mentioned games, because that's when I talk to parents, I ask, how do your kids use the internet? And they all say, oh, they're playing games, they're playing Minecraft, they're playing Roblox, they're playing whatever new game is coming out. And they're that's how they're interacting. All these games have a chat feature, a way that they can talk and communicate. And so the first and foremost is education that they don't know who is on the other end that they're talking to. And just because they say they might be someone, they might be a 12-year-old boy or whatever, that doesn't mean they necessarily are. And so important to always remember that like we don't know who's on the other end. So that those basic online safety tips. Also, one huge thing that we teach in our curriculum is healthy relationships. How can you identify what a healthy relationship looks like? We give kids characteristics of healthy relationships. We give them characteristics of when a healthy relationship might have gone to an unhealthy relationship. Because going back to this grooming process, we understand that the relationship often will start out in a positive way. And so if we can give the kids some skills to be able to recognize, hey, this relationship has gone from healthy to then unhealthy, they can recognize when, okay, it may have started out positive and now this person is trying to exploit them or trying to take advantage of them or leverage that need that they filled, and ultimately leading to some type of exploitive or trafficking situation.
Great. And Dr. Kleinschmidt, what's your take on this?
Yeah, so Josh, I'm glad you brought up just media use in general. I do think knowing what your kids are doing online and also paying attention to the time spent. Like we have seen that hours spent on social media or gaming or other, internet related activities is really negatively associated with mental health. And so these kids do feel more isolated. They have more depression. They have more self-harm and suicidal thoughts. And so knowing that and helping kids sort of broaden the activities that they participate in. I think another thing is really setting up just good communication between parents and kids. I get a lot of, it's funny, when I talk about what I do, people are like, oh, but you have to work with teenagers. And I love teenagers. They're so fun to work with. But part of what they do when they're trying to figure out their identity is that they give trouble to their parents, right? They're supposed to be pushing their parents away a little bit to try to figure out who they are apart from their parents. And so a lot of parents will be like, oh, my kid doesn't want anything to do with me. And when we talk to the kids, it is not true. They really miss that connection that they used to have with their parents. And so really as a parent, finding opportunities to just sit with your kids, if they bring up something, not immediately asking, why, or like if they say they're having a rough day or they're feeling depressed, being able to sit with them about that, not grill them. That's a lot of times what kids will tell me is the worst part, not trying to fix it, but instead like practicing validation, like, wow, it is really hard when you feel like that. Is there something I can do? And really just trying to build that relationship of trust. Like, hey, you can come and talk to me. I'm not going to get angry about what you tell me. And I'm going to be like a safe person for you to talk to. And then the last thing that I was thinking as we were talking about this too, is also just kind of providing them opportunities for positive social interactions with others. And I think that's another really good vulnerability prevention piece, getting them in clubs, getting them in sports, finding things that they're interested in apart from social media. And then finally, I think this is my second finally, but really building up coping skills for when they're feeling stressed or anxious or depressed, because a lot of times if kids cannot cope with things like that, they withdraw more, they isolate more, they start to do unsafe things such as use substances. And as we both talked about, substance use is a really high vulnerability to be trafficked because most kids don't have enough money to be able to pay for the substances that they become addicted to.
Thank you. So let's give some more resources to families here. Protect is in the schools. Explain actually how that works in the schools so that people on this understand who's being trained and how.
Yeah, we really have a four-pronged approach when it comes to building a healthy school climate. And it first starts with a protocol, a coordinated response protocol that everybody in the school system knows exactly what to do in case a situation does arise. Then it's training the school staff. In the training that we had mentioned before, it's training all the school staff on what it looks like, how to use a trauma-informed approach, and how to respond. And then we bring the education to the students that gives them the skills to find ways to combat human trafficking, to build up their resilience, so ultimately they can resist some of these tactics and situations that they might fall in. And then the last thing we do is we train parents and community members. And so everybody is all on the exact same page and knowing what this looks like and how to fight it. Human trafficking thrives in the shadows. So the more education that we have around the entire community system, the better off we're going to be, the better chance we have to ultimately end human trafficking.
So if somebody has a feeling that they need to call on, I know there's a national human trafficking tip line, and maybe I can explain how that happens a little bit. Those tips go into a central U.S. bank, and then people get those and they send those back out to the law enforcement that are within the communities. So they may go out, but they come back to the people closest to us. But do you have that human trafficking resource, that number?
Yeah, of course. That's 888-3737-888.
And then, as we talked earlier, the suicide prevention line, do you have that again, Dr. Kleinschmidt?
Yes, it is 1-800-273-8255.
And then the Safe UT app is available for everybody to download in the state of Utah on smartphone apps. You can get that. You can just chat right in. It can be anonymous chat. It doesn't need to be anything that everybody knows about. And that was really written in there so that the kids could find help without feeling like there was any sort of stigma with anything around it. So it's a great resource for our kids. It's a great resource for us. If either of you, I'd like you each to take just kind of a closing moment to tell us what you can tell us about the conversations that we've had today, what you think that the listener could most benefit from this conversation.
Yeah, I mean, just by listening to this conversation and spreading that awareness and education about human trafficking, about exploitation, and why it's so important that we're combating this in our homes, why it's so important that we're talking about this, because again, it thrives in the shadows. And so the more education and awareness that we can spread, the more conversations that we can have with our family, with our friends, the more that we're able to talk about this, the more awareness that we're able to spread. Like we said, the teachers, every time they hear about it, they think of the students in their classrooms. Almost always they can recognize one student in their classroom or in their school system that is going through and experiencing a trafficking situation, showing some of these vulnerabilities or risk factors. So the more we talk about it, the more we're going to be able to recognize it, but the more we're going to be able to prevent it and ultimately stop it.
All right, Dr. Kleinschmidt.
Yeah, I think, as I've been thinking about what we've been talking about, I think my biggest take home point would be that mental health issues all of us really, but kids and teens are really, really common. They happen across all socioeconomic spectrum, across all types of families, and really also need to be talked about and recognized. And there's help out there, anxiety, depression, school difficulties, all of it is very treatable. And being able to open up to families and go and find therapists or parenting groups that are offered through most of the school districts that I'm aware of, or psychiatrists like me, happy to do evaluations and prescribe medications. And there are hotlines that people can call if they really don't know where to get help. Just knowing that there is help for mental health, and please talk about it and don't sort of assume that just because my child or my family hasn't experienced that kind of adversity that maybe it's not here. I think just having a nice open dialogue with your kids if you're a parent, or with your students if you're a teacher, or are an aunt with your nieces and nephews, just being very open about, hey, people feel depressed, people feel anxious. Is that ever anything that you've struggled with? How can I help you figure out how to cope with that? Hey, let's look up some resources online and see what we can figure out about how to help you feel better.
Awesome. I love how both of you are such community assets, that both of you work with populations that may not have these strong households to have the support that some of the kids that we've talked about today do. But one of the things that I would like to offer also is dōTERRAhealinghands.org/hope is a place that people can go to find out how to prevent through protect and other ways, become more educated. We also have a link to ways that people can look at possible adoption or supporting adoptive families so that we can get these kids into caring homes and people who love them and that they become connected. Also, responsible rescue. That's a very important thing that is done by law enforcement and by certified task forces. And we really are behind that at dōTERRA. Find that at dōTERRAhealinghands.org. And then also the restorative care is so important, as we've talked about today, the trauma-informed restorative care. Places like Dahlia's Hope and other places that people are able to find real long-term solutions, ways to prosecute traffickers, ways to get out of the entrapment that has been there mentally, emotionally, spiritually, after they've been freed physically. So we see a lot of stories on that and would welcome anybody to come to that site as well. There's a lot of resources out there. Utah is actually leading the fight on this. It's amazing to see how many people are really understanding this now and moving forward. So if you, as a listener, would like to become more involved, you can come to dōTERRAhealinghands.org/hope. There's some ways of doing that. And then also look at 3Strands Global. And we're so grateful for you, Dr. Kleinschmidt, to share your expertise with all of us to help us understand what does make a healthy relationship and family and help us today. So thank you for being with me, and I hope this has been helpful for everybody listening.
This podcast was brought to you courtesy of 3Strands Global Foundation with the support of dōTERRA Healing Hands. Thank you to our hosts, Missy Larson, and guests, Dr. Christy Kleinschmidt and Josh Loiza, producer Richie T. Stedman, and co-producer Terry Palmer. Music provided by Grounder. For more information, go to 3strandsglobalfoundation.org and dōTERRAhealinghands.org. Thank you for listening.